And now back to Roger Cooper and the American Health Journal.
Some doctors say there's little, if any, good data to show that taking antioxidant supplements protects you against cancer. In fact, they say the best data seems to suggest just the opposite. It increases your risk for cancer. We spoke with research biochemist and physician Professor Randolph Howes, who's the author of Dangers of Excessive Antioxidants in Cancer Patients, to learn how his research has uncovered the truth about antioxidants.
An antioxidant is a compound or an agent that blocks oxidation. Oxidation is the removal of an electron from something. The antioxidants will block that chemical function. If an antioxidant blocks the chemical function of oxidation, it blocks some of the most important vital pathways in the body, the pathways that protect us from pathogens, protect us from cancer. There are many studies that show that the antioxidants, in fact there's 108 presented in this, but 118 in this book, that show that the antioxidants do not prevent or do not affect in a positive way the treatment of cancer. Of those, 39 studies show that the antioxidants cause harm. Of these same studies, 26 show that the antioxidants increase the risk of other cancers. And of those, 2 show that the antioxidants increase the mortality associated with cancer, gastrointestinal cancer, and esophageal cancer.
Dr. Howes told us about the antioxidants that are contained in our food.
Antioxidants are across the board in a wide spectrum of foods that we get. They were put in to fortify them back when we thought patients might have a vitamin deficiency, but we find out that's very rare in this country. Only if you have a known deficiency would you start to take a supplement of vitamins A, C, or E. Not only that, the antioxidants are put in the foods to prevent spoilage or rancidity. If a product, particularly one which is edible, is going to have a foul odor or change colors or turn brown, then antioxidants are relied on to stop that. Well, in the meantime, though, we're ingesting these same products along with that food.
Dr. Howes explained how antioxidants can cause cancer.
It seems like we're doing more to allow cancer to manifest itself. And we're doing that. You mentioned smoking. And smoking, cuts down your oxygen consumption 25% right off the bat. There's a lot of methemoglobin then in the blood. To me, this is one of the primary mechanisms why cancer is prevalent in smokers. But not only that, the antioxidants that we are stacking, that we are overloading on, is knocking down, is diminishing our most protective system from cancer, which is an oxidative system that tells the cancer cells to kill themselves. It's called apoptotic execution.
Dr. Howes described how antioxidants could affect cancer survivors.
What we're seeing is that 1 in 20 adults in America is a cancer survivor. We're seeing that there are 12 million cancer survivors in America. And unfortunately, 60% of those 12 million cancer survivors are taking supplements. They're doing just the opposite of what they should be doing, because many recommend them, and most of them recommend them for profit. In the end, we have to rely on scientifically based evidence. And the evidence shows that in the laboratory, that these antioxidants will shield cancer cells. They will continue to grow. My best advice is if you're taking antioxidants to stop. If you're not taking them, don't start. Eat a well-balanced, nutritious diet, and exercise as tolerated. In looking at the data overall, avoid stress, anxiety, depression, and you're home free.